And I ask that the administration start to take hard numbers, make sure they keep a clear record as to what's going on in minority communities, including Latino communities. And it's not surprising. They're usually in communities that have the least protection. They're usually in communities that have the least insurance, least likely and most concerned about going to a hospital, et cetera. And so the first thing I would do is make sure that everyone understood that anyone who is affected at all by the coronavirus is not going to have to pay anything for a test or anything for the treatment that they receive in that test. That's one of the great fears and concerns people have. These are also the people that, as you know, are the people who have to go out and keep our society running. You and I get to stay in our homes doing the jobs we're doing. Matter of fact, they don't let us out of our homes. And when they do, we're wearing masks. And what's happening? The person staffing that grocery store shelf, the first responder, the person who is out there making sure that they're responding to a crisis. They're all the people we're talking about. They tend to be the lower end of the pay scale, and they tend to be not paid attention to. So the first thing I think is going to happen is, and excuse me for going on, but I feel strongly about this. The first thing that's going to happen here is I think the Band-Aid's been sort of ripped off. The American public, who wasn't particularly prejudiced or not caring, all of a sudden has realized, whoa, I didn't know that the reason why I was being protected on A, B, C, D, or E, or someone making the minimum wage. I didn't know that the person who's risking their lives for me is a person who is boom, 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 lives in such and such a neighborhood. So I think we have an opportunity to deal with some of these structural changes when we get out of this crisis and we begin to rebuild this country.
So let me ask you about that, because the other side of the equation here is that 400,000 people in Wisconsin are out of work. People are hurting.
Yes.
We had a very large protest here over the weekend where people in the Milwaukee suburb saying that it's time to reopen. They say the virus is killing their livelihood. So tell me, should the country start to reopen by May 1st? What do you say to counties that have 0 to no cases? Should they be allowed to reopen?
Look, if you take a look at Milwaukee and look at your counties, look at Wisconsin generally, Milwaukee, the hospitals in Milwaukee have less than a week's supply that they need. The hospitals have less than a week's supply of goggles and face masks and swabs and shields. And hospitals, 1/3 of them have less than a week's supply of those N95 masks, 96 masks. Look, we need to provide for. The president's got to step up, take responsibility. He's the commander in chief, and get this material out. He has the authority under the Defense Production Act to be able to go, just like he did with General Motors, and say, build ventilators. He has the same authority to say, everybody says, look, there's 3 things that have to happen: testing, tracking, and treatment. Well, we don't have nearly enough tests out there, number one. We don't even have the swabs to be able to take the test. What has he done? He has said it's not his responsibility. It must be the governor's responsibility. He has the authority under the Defense Production Act to go to a corporation and say, make me 1 million swabs. This is what you do now. He has that authority now. He's not exercising. He's slow going. Everything is slow walking.